right and left kidney, which is you are going to get right and left kidney and ureter and urinary bladder. Interior of kidney, how? If we dissect the kidney, how it appears? That is, this is also. This is the one which is you can see the stones. Stones. More than 200 stones in one kidney. 200. This is a rare specimen of our department. That is, you all remember. There are small stones which are 200 plus. I have only counted, mounted and pasted there. So this is one which is you can see the many stones, which is a rare specimen of our here stomach. One more thing, this is a duodenum and this is a pancreas, which is I am showing is a gland pancreas. That is the one which is you have to remember. Deficiency of insulin causing the diabetes mellitus. So this is the one which is the pancreas. This is spleen, which is not there in the specimen that I am showing you. Here is the spleen. Okay, spleen is a lymphatic organ, lymphoid organ, largest lymphoid organ connected to the blood vessel system. What it does? Hemopoiesis, protection, phagocytosis, all work is done by the spleen. Okay, you can see this stomach and all I have stored. There all the we have only pancreas you have not seen and spleen. Those I have covered here. Okay, all model. This is the one which is a mummified body. Suppose you have seen the heart here. Okay, heart you have studied here. So heart exactly below this left side, how it is situated. You have to mark the doctor should know the all these things where exactly below these 4 points will be the heart. So that type you have to study. This is one mummification, drying off of the remember, and this is all we call as a mummified body. We use this body for the surface marking. That is one you have to remember. Heart and all we marking, abdominal organ, kidney, arteries, we make this one. This is all about the after studying organ, we have to mark on the external surface of the body. That we call as a surface marking. Okay? Heart different walls and heart and lungs. Here also we get the lungs part which is you also remember. Here this is the liver, inferior surface of the liver, which is you can see. And these are all specimens of the heart. What is the blood supply of heart? Heart is supplied by the 2 arteries. Coronary artery. Right coronary artery, left coronary artery. That you have to know. Here you can see the coronary artery, which is here traced here. This is painted. Painted for the identification that we can do it. Then I have told mounting of these specimens. I have told 10% formalin and 90% water. Kept, you can keep these all preservation till the 100 years or more than that. So that is the one which is a preservation mechanism. Okay. So this is all you have to remember about in the lung. And here also all the parts, glands which are will get. Here also kidney and this is the one specimen where fibula is there. Fibula is there. Bone is strong because of calcium. Bone is why it is strong? Because of the presence of calcium. Calcium is there, then only it is a present. So that if we remove calcium, suppose here in this bone, calcium is removed, you can bend or twist the bone. Strength of the bone is removed under keeping the calcium, that is the hydrochloric acid. And calcium is removed means you cannot. Cartilage we call. Cartilage and bone is different. Bone is the strongest. So these all specimens see. And this is the one specimen which is a one girl used to having the habit of eating hairs. Hairs eating होता. That is abnormal. Trichosis we call. ते एक दिवस ऑब्स्ट्रक्शन झाल्यानंतर काढलं. ऑपरेशन करून काढल्यावर ते स्टमक शेप मध्ये आलेलं आहे. This stomach shape which is you can see. That is the one which is a we call condition trichosis. 6 महिने घरातली लोकांना चुकून खात होती 6 वर्षाची मुलगी. And that is one which is okay. So this is what you have to remember. Here you can see kidney, ureter, urinary bladder, interior of urinary bladder. Okay. Interior of urinary bladder.
Is this hammer?
Fetus आहे हे सगळे. Fetus. mounted abnormal fetus, which you can see all your fetus, all abnormal. This is the one part where you can see the spinal cord, sections of spinal cord, lower end of the spinal cord where we can see. Okay, spinal cord you can see horse tail like this one, which is we call chorda equina, phylum terminalis we call ending of the spinal cord, how it is ends. That is one you have to remember. Okay. So next, which is these are the brain sections. Here you can see these are the how we take the CT scan and all like this. We have the brain sections, which is you can see this is all about the brain section, cut sections of the brain, cerebrum, cerebellum, and all. This is the intestine where you can see the complete intestine, one which is you can see, and this is also liver. That side you can see the almost all the parts of the different parts of the liver. So this is the one cut section of the sagittal section of brain. Sagittal section, whole brain you have seen, and this is the sagittal section of brain. This is the covering of the brain meninges. हे सगळं आहे, सगळं fetus आहे. One more important here, you can see the thyroid gland. Thyroid gland in the neck region, thyroid gland. And below that we have the trachea. Above trachea, the clasping, that is we have the thyroid gland. Thyroid and trachea. Here above we have the tongue and all. That is all. And these are the fetal dissection. You can see both the sides, brain to the all, thorax, lung, how the fetus is having. So those all section. And posteriorly you can see the spinal cord of the fetus. That is very important. Okay, that is all about the total. These are the skeletons of the other animals. This is a mouse skeleton, and this is the one which is next is a rat. Here is a rat skeleton. One which is we can see. This is a rat skeleton. If you can see rat skeleton. This is the one which is we study the, that is one mouse skeleton. Goose member, goose. Okay, and you have seen a human skeleton. So this is all about the total skeleton comparative anatomy. So this is all about the briefly about the our department. One this specimen. This is very important. This is a brain with the spinal cord. Very important. You can see the brain, total brain, covering of the brain is there, and this is a spinal cord. We get the spinal cord. This is the brain and spinal cord. Okay, so this is all about the all organ. Any questions you have, you can ask.